Good afternoon, and thank you for joining us for the June 30th COVID-19 virtual news conference. My name is McGuire. I'm a public information officer working in the Humboldt County COVID-19 Joint Information Center. We'll start by introducing this week's panelists. Public Health Director Sofia Pereira, Emergency Services Manager Ryan Derby, County Health Officer Dr. Ian Hoffman, and we're happy to welcome North Coast Senator Mike McGuire. I'll start with a brief update from the Joint Information Center before our panelists take questions from the media. As of today, a total of 4,569 Humboldt County residents have tested positive for COVID-19. Since the most recent news conference on June 16th, the county has reported 12 additional COVID-related hospitalizations, and hospitalized residents ranged in age from their 40s to over 80 years old. And since June 16th, 3 members of our community have died with COVID-19. Today marks the final day that the county's COVID-19 response will be coordinated by the Humboldt County Sheriff's Office of Emergency Services. Starting tomorrow, the response will transition to a departmental operations center under the Department of Health and Human Services Public Health Branch, and our panelists will share more details about that. As for the COVID-19 Joint Information Center, daily reporting and social media outreach will continue for now. Members of the public may notice some changes to the visuals on some of the county's outreach materials, but information will continue to be provided on a daily basis for the time being. And the COVID-19 call center will continue to operate Monday through Friday from 8 a.m. to 5 p.m. Staff are available to answer questions related to testing, safety measures, and vaccination in Spanish and English. So give us a call at 707-441-5000. Now let's hear from our panelists. We'll start with Public Health Director Sofia Pereira.
Well, good afternoon, everyone. First of all, I really want to recognize and thank Senator McGuire for his partnership on the clinic that we are having at the Humboldt Crabs this Friday. I'm sure he'll talk a bit more about it, but just really want to express our gratitude for his tireless support of public health and really our community in the North Coast. So really grateful for that partnership and for his leadership. Just wanted to give a brief overview of what this transition is going to look like within public health, moving from the Emergency Operations Center to a departmental operations center within public health. So really what this means is that our staffing structure is really getting streamlined. So having staff really be focused on the COVID response effort, but really rolling this work into people's existing positions. We have extra help staff that we are able to take their work and shift that to ongoing and permanent staff. And we are seeing that staff that have been working in this response tirelessly for over a year, for several months, are now able to go back to their home program. So folks will see some changes internally. But from the public perspective, we are still working tirelessly on COVID response from investigations to vaccination. So that has definitely not changed. This is really a more internal structural change that's going to be happening. And lastly, I just also want to thank Sheriff Hansel and EOC Director Ryan Derby for their leadership and partnership with public health since the very beginning of COVID coming into Humboldt County. Really grateful for the technical assistance and expertise that they brought from the emergency management perspective. And this partnership really has served our community well. So I'll leave it at that and look forward to your questions.
Thank you, Sofia. Ryan, can you please share an update?
Of course. Good afternoon, everyone. As Mariah stated in opening, today marks the formal demobilization or shutting down of the Emergency Operations Center. So what that means is we're fully transferring the management, the planning, logistics over to the Department of Health and Human Services and Public Health Branch for the duration of the COVID-19 response. The role of OES really is to coordinate, communicate, and collaborate with countywide partners to assist in stabilizing an incident, or at the very least stabilize it to the point where response activities can be incorporated more into routine governmental functions. And that's the case today. We feel that we've been able to stabilize the response structure to a point where we can hand the torch over to DHHS and public health in a way that they'll be able to sustain the same level of services and the same level of response that we've seen for the past 15 months. What that doesn't mean is that COVID is over, because by no means is it over. There's still a lot of work to be done, a lot of vaccination to get out into the community, ongoing testing, and then the whole recovery aspect that's likely going to last years for recovering businesses, families, and for those who have lost loved ones. But I can say confidently that we're handing things over in good shape and in very capable hands. I just want to highlight a few of the accomplishments of the last year and a half. So in the last 15 months, the EOC, in coordination with all county departments, various jurisdictions throughout the operational area, Humboldt County, and in coordination with over 200 volunteers, have assisted with standing up an alternate care site, which is essentially a field hospital, something that's never been done in Humboldt County before. We stood up countywide COVID-19 testing just a few months after the pandemic started. I was going through my notes yesterday and found the first report from the first case that we had. And at that time, there was no COVID-19 testing. And now we're doing that mobile countywide. So it's really impressive to see the infrastructure that's been built through partnerships. And we're really here to sustain that. So by OES demobilizing the EOC, that doesn't mean that we're not going to be involved. We're still here for technical assistance if there are questions. But we do feel that DHHS and public health can sustain this. We've also seen some really widespread logistical support to healthcare communities, healthcare districts, and first responder agencies in terms of personal protective equipment. Early on in the pandemic, there were nationwide shortages. We weren't able to acquire masks, gloves, gowns, hand sanitizer, and the EOC was able to assist with providing that. So I'm really proud of these accomplishments over the last 15 months, and I'm thankful for all of the partnerships and really for the community support that we've seen. I mean, we recognize that this pandemic or this disaster has been like nothing we've ever seen, and people have been affected in worse ways than others in this community, particularly those who've lost loved ones, businesses that have had to permanently shut their doors. It's been really, really hard, but we've seen tremendous support. So I want to thank the public for that. And really, part of the focus of this transition is for my office to be able to transition to wildfire planning and preparedness. We're moving into a season in a year that's historically dry, and we're already starting to see some fires pop up throughout the state. So this is an opportunity for us to look for what's potentially coming next. We're starting to do some countywide evacuation planning, creating zones for the entire community, and working on some ways to better notify the public to make the impacts of the next disaster less. But really over the last year, I'm thankful for the opportunity to have learned what some of our gaps are. And I feel like that's going to better serve us and better serve the community ongoing. So thank you all, and thank you for the opportunity to be on the panel today.
Thank you, Ryan. Dr. Hoffman?
Well, thank you, Ryan, and also want to really appreciate and offer gratitude to Sheriff Hansel and Ryan Derby and all of the OES folks who've been working with us alongside public health and DHHS throughout this whole pandemic, the whole incident response. And also thank you, Senator McGuire, for being here today. Your support has also been so valuable to our community, to Humboldt County, and to public health throughout this response. Want to just take some few minutes today to update us on where we're at with the pandemic. The first thing I'll say is that emerging evidence is very clear. The vaccines work extraordinarily well. They're extraordinarily safe and effective, and they work against the variants. The variants that have been here and the variant that will very likely soon be here. And I'm speaking about the Delta variant. We all have been watching what's been going on around the world, across our country. We're seeing now 20% of cases across the United States are Delta variant. While we've only had a handful of Delta variants here in Humboldt County, I don't suspect it'll be very long until we see the vast majority of cases are going to be Delta variant here. So the vaccines work against the Delta variant. They protect you against it. And I just want to say that if you are someone who's been waiting to see whether the vaccines have been effective, if they're working, if they're safe, now is the time. You don't need to wait any longer. They are absolutely safe and effective, and they're working. What we know so far is that people in Humboldt County, of the data that we've looked at, the unvaccinated are 80 times more likely to get COVID-19 than the vaccinated. So while there have been a handful of vaccinated folks who have come down with COVID, it's very small and to be expected, and the cases have been primarily mild. And we have also seen no hospitalizations and no deaths from someone getting vaccinated. So you compare that to the hundreds of hospitalizations, 50 deaths from COVID-19 of the only few thousand people versus the tens of thousands of folks who've been vaccinated. One other thing about Delta variant that I want to bring up is there are increasing concerns around continued masking among the fully vaccinated. We've seen countries like Israel, we've seen the largest county in the United States, LA County, recommend fully vaccinated people continue to mask indoors. The WHO, CDC officials have warned that the Delta variant is one of the biggest concerns yet in this pandemic. Fauci, Walensky have both stated that. So again, we know that it's coming. I think that we have tools to deal with this. We have vaccines and we have masks. And I think that, even though it's safe to go without a mask if you're fully vaccinated, we've talked in the past few weeks about people who might choose to continue to mask in public. And I think, from a public health perspective, we still support that. If you choose to continue to mask because you're worried about variants, you have a loved one at home who's vulnerable. Maybe you yourself are fully vaccinated but vulnerable. These are all reasonable, reasons to continue to mask, even if you're fully vaccinated. So, we want to support our local residents who do decide to continue to mask, given the scenarios. And we'll cautiously watch and see what happens as the Delta variant unfolds. The last thing I'll say about the Delta variant is that there's also emerging evidence that 2 doses of the vaccine, that getting your second dose is actually more effective against it than the previous variants. So if you're one of those folks out there who has been waiting to get your second dose because you're unsure if you need it, because the first dose was pretty effective, or you're worried about side effects from that second dose, please go out and get your second dose now before we have widespread Delta variant. Again, the data is looking pretty clear that those with 2 doses are much more protected than those with just 1 dose. And thank you, and look forward to the questions, and turn it over to Senator McGuire.
Thank you, Dr. Hoffman. Senator?
Thank you so much, Angel. Very grateful. First and foremost, I want to say how honored I am to be able to join each and every one of you. Good afternoon. And I just want to take this moment, especially as we look at the largest public health crisis to hit this nation, to hit California in over a century. I want to take a moment to say thank you to Dr. Hoffman, Mr. Derby, of course, Sheriff Hansel, for their tenacious work. And I want to offer congratulations to new Public Health Director Pereira. We are excited that you are on board, and know that your service, which has been long time standing here in Humboldt County, your service will continue in your new role, and offer you a hearty congratulations. What I'd like to be able to focus in on is mobile vaccination clinics that will be moving forward here in partnership with the California Department of Public Health and Humboldt County Department of Public Health. What we know is that this needs to remain an all hands on deck effort. State working with the county to ensure that we continue to increase our vaccination rate here on the North Coast. In many North Coast counties, the vaccination rate is trending lower than the overall state rate. That's why you're going to see a continued focus on going out to where folks live, especially in rural California. There are 3 clinics that we'd like to be able to announce today. Number 1 will be in Klamath in partnership with the Yurok tribe on Friday, July 23rd. We're grateful for the leadership of Humboldt County Department of Public Health, and with the funding from the California Department of Public Health, we'll be partnering with the Yurok tribe on a large mobile vaccination clinic. Second is going to be on Saturday, July 24th. As you are shopping for your veggies, we encourage you to come get your shot. So we're going to be at the Arcata Farmers Market, and we look forward to seeing each and every one of you starting at 10 a.m. on Saturday, July 24th. And as Madam Director just mentioned, we want to strike out COVID this coming Friday. Here's what we know. When it comes to the number of cases, hospitalizations, as well as deaths in America, the vast majority are from unvaccinated residents. And with the Delta variant, as Dr. Hoffman just eloquently stated, with the Delta variant taking hold throughout the United States and here in California, it's more important than ever, if you're unvaccinated, to get your first shot. So we welcome you to watch the Humboldt Crabs beat the Solano Mudcats this coming Friday. There are 2 important times. Number 1, 5 o'clock, our ballpark vaccination clinic opens up. So Humboldt County Department of Public Health will be out there. I'll be out there. We'll have Chairwoman Supervisor Bass from the Board of Supervisors with us. We hope you can join us at 5 o'clock. The first 100 fans who show up to get their vaccination shot, it's free, by the way, not only will get into the game for free, you're going to get, and this is very exciting, a hot dog dinner that night as well. So hot dog, a game, and a vaccination shot this coming Friday to watch the Crabs beat the Mudcats at Arcata Ballpark. The last thing I'll say is this couldn't come soon enough. What we know is that we have to continue to increase the vaccination rate, especially in Humboldt County, which is below where the state is at. And I want to say again, thank you to Dr. Hoffman. Dr. Hoffman, you have been on the front lines of this, ensuring that you are going to the folks who need it most. And I just want to publicly acknowledge your hard work and look forward to seeing each and every one of you this coming Friday for our ballpark vaccination clinic with the Humboldt Crabs.
Thank you, Senator McGuire. Now we'll move on to questions from reporters. We'll start with Isabella from the Time Standard.
Hi, thank you for taking my questions. So we've started seeing fewer folks wearing masks, and even in healthcare settings. On Tuesday, the Board of Supervisors voted to allow county staff and the public to self-attest to vaccination status and go mask-free. What are Dr. Hoffman's thoughts on continuing to wear masks, and especially, as he had said, given the prevalence and transmissibility of the Delta variant?
Yeah, thanks, Isabel. It's a great question. You know, really where we're at in the pandemic is at a place of personal choice. When we were at the beginning of the pandemic over a year ago, we had our whole population had not seen this virus. And so we knew there was potential to crush our medical system. We now have 65% of our eligible population in Humboldt County with at least 1 shot. You know, we've had over 4,000 residents come down with COVID-19, so they have some immunity. So we have a pretty sizable chunk of our community with our community that has immunity now. So it's a much different place. So we're not mandating that everyone wear a mask anymore, unless you're unvaccinated, in which case you should always continue to wear a mask. As far as fully vaccinated people continue to wear a mask, I think that, you know, it's really, again, a personal choice of, you know, do they feel it's something they want to do to protect themselves, then they should absolutely do it. I think that, you know, the risk is pretty low if you're fully vaccinated, and especially if you're younger and healthier, you certainly are at much lower risk than you would be if you were unvaccinated. If you are an older person, like I said, who is fully vaccinated, or you have health conditions, or people in your family who have health conditions, or you have unvaccinated folks at home, you know, it's not unreasonable to continue to wear a mask until we know a lot more, and especially with the Delta variant being more than 50% more infective than the Alpha variant, which was also nearly 50% more infective than the original type. So we're looking at, now a new variant that's double contagiousness of the original. So that's where we're going to keep messaging on letting people know what the risks are. I think it was really up to the Board of Supervisors and the county to decide which direction they were going to take. Public health made it very clear what those options were. So I fully support the county and the Board of Supervisors in their decision.
I suppose I would just follow and ask, you had said that there had been a few cases reported of the Delta variant locally. So I'm curious as to how widespread it is in Humboldt at this point, and also has the variant contributed to further breakthrough cases?
Yeah, so in terms of how widespread it is, we really have had only a small handful of Delta variants. It's too early to say anything about it other than, what we know from our experience so far is that when we first started seeing the Alpha variant, a month and a half, 2 months ago, it was the exact same thing. We saw a couple of cases, the next week a bunch more. Within 2 or 3 weeks, it was all we would see in the genomic sequencing. Then there was a shift to the P1, the Gamma variant. In the last couple of weeks, month, we've seen about 50-50 between Alpha and Gamma. So starting to see that creeping in now with the Delta variant, and we don't have any strong evidence that it's spreading locally. Most of these cases were travel related. So I think that it's only a matter of time. And when you look at LA County saying that 40 to 50% of their new cases are Delta variant, it's just a matter of time. It's going to happen here too. And we're going to see it in mostly in unvaccinated people. And we will have some fully vaccinated people who get it, just like we've had fully vaccinated people who got Alpha and Gamma. So it's to be expected. But the main thing I can say right now is that the numbers of fully vaccinated people who are getting infected are extraordinarily low. You're still 80 times more likely to get infected if you're unvaccinated, and your risk of hospitalization and death are minuscule compared to if you're unvaccinated.
Thank you very much.
Thank you, Isabella. Any follow-up questions on continued masking? Or any follow-up questions on variants? All right, we'll move on to Iridian from the North Coast Journal.
Hi there. My question is on the mobile vaccine clinics, and I've just been wondering how they're going and if public health has been seeing a lot more people come to those. And I know that the SNAP nurse team is going to be here until early August, but because our vaccine numbers are kind of low, is that going to be expanded, or are they just going to stay until then?
Great question. So our mobile vaccination effort is going really well. It's strong. The SNAP nurse team definitely has added some extra capacity for us to get out to all different parts of the county. So we definitely have been working pretty hard, reaching folks. I think we're out at Petrolia today. So our clinics are up on My Turn. So folks, if you want to see when the next clinic is, we are going to mobile home parks, we are going to community centers, we are going to churches across this county. So go to myturn.ca.gov or call the Joint Information Center at 441-5000. Those are great ways to find a clinic that's going to be near you. Although I hear you get a free hot dog dinner if you go to the Humboldt Crafts game and get vaccinated there Friday night. So yeah, we are having the SNAP nurse team until early August. And, we're really looking ahead of, how this is going to transition into our standard, vaccination program that we run in public health. So we're definitely looking at what staffing model is going to make the most sense to continue with COVID vaccinations, but also making sure that we're doing our standard, school-based vaccination program as well within public health.
And if it's okay to add as well, the state of California is going to be budgeting over $350 million into this next fiscal year, which starts July 1st, for immunization grants to be able to assist public health agencies to be able to continue, whether it's brick and mortar vaccination sites or mobile vaccination units. It's become loud and clear that the state needs to continue to step up to partner. While we are seeing great improvement in COVID infection numbers, this is far from over. And especially as we head into fall and into winter, it is up to all of us to be able to get as many folks vaccinated as possible. And that means the state needs to put money on the table to be able to help Dr. Hoffman, Director Pereira, get folks vaccinated and make it as easy as possible, which is why you're going to see an additional, it's about 357 million total. We're also going to put about 900 million on the table for local schools to assist with testing as we move forward, to be able to isolate classrooms and schools as we move forward, with the expectation that all schools in California will open for in-person learning come this fall.
And I'll just add to that on the mobile effort, we really are in the long game here. This is about getting out and meeting as many people in as many places as we can where they need to be to get vaccinated. So breaking down those barriers, whether they're financial barriers, distance, location barriers, barriers related to work, childcare. The mobile effort really gets at many of those. We spent months and months doing mass vaccination, and we're not going to see those kinds of numbers again, but that doesn't mean it's not worth it. It's every single person who gets vaccinated is worth it. And we'll keep vaccinating until, as long as there are people out there who want to get the shot, we're going to keep going out there and bringing it to them.
Any follow-ups, Iridian?
Yeah, so I was just wondering how many vaccines are allocated to the mobile efforts?
Great question. It really is going to vary on the clinic that they're going to. So, we look at how many folks have signed up on My Turn. So we make a calculation on that. We also are getting quite a few walk-ins percentage-wise for these clinics. And we obviously don't want supply to be a barrier at this point, given that we do have enough supply on hand. So it really varies. We make sure that we bring as much vaccine to meet the need, the anticipated need for any clinic. So some clinics we anticipate, 75 to 100 people. Sometimes we're going to a small, community hall in Bridgeville, as an example, and we're not going to bring 100 doses there, but we're going to, scale it to what we think the anticipated need is based on registration and then an estimation for walk-ins.
All right, thank you.
Thank you. Michael from North Coast News.
Yes, so my question is related towards testing. I know the OptumServe testing site is moving away from Redwood Acres to the Wharfinger building tomorrow. And I know throughout kind of the pandemic, a lot of or at least a large percentage of the people who were getting tested were doing so because they were either required to by work or another sort of mandate. I was wondering if you had any idea of the percentage of people who are getting tested that are doing so, who are seeking it out rather than being required to.
Great question, Michael. I don't have a percentage. I'd say you're absolutely right. The focus has shifted, and I'd say the biggest reason that's shifted is that we have over 50% of our population who are fully vaccinated now. don't need to test anymore on a routine basis for the vast majority of those folks. If they're healthcare workers in certain places, they might still need to. But as a routine public health measure, we are not recommending that fully vaccinated people, even if they were exposed, go out and get tested unless they're having symptoms, in which case they should get tested and check in with their doctor or provider. So that in and of itself has cut down dramatically on the amount of testing that's out there. But there's still a significant portion of the population that are unvaccinated and should continue to test. And, whether that be routine testing through their employer or just personal preference to keep getting routinely tested, or because they have an exposure to someone, or because they have symptoms that they're concerned about. The testing has been pretty steady over the last month or so. I suspect that will, continue to stay steady, or potentially even go down more as we get more vaccination out there. And so that, really that testing effort is sort of a mirror flip inverse of the vaccination effort.
And I guess kind of a quick follow-up related to that is, with testing rates kind of seemingly going down because more people that are vaccinated don't necessarily need to test. I mean, what kind of safeguards are currently in place now to detect when, the virus may starting to be spread more among people that will reach those people that are unvaccinated, and with, maybe the Delta variant comes through, and I mean, just what kind of safeguards now are in place to detect that?
Well, I think the safeguard against that is if you have COVID-like symptoms and you're fully vaccinated, then you should definitely be tested. We are prioritizing any fully vaccinated positives for whole genome sequencing, so we can look at those more quickly. Just as we're looking at people who are hospitalized, people in outbreak settings where there's a large number of people, and then we end up doing sequencing on as many as possible, but those are the ones we want to look at more closely. So I don't think, though, what the science is really pretty clear on now is that the asymptomatic spread among fully vaccinated people is highly unlikely. I think we're getting to the point where if you're fully vaccinated, COVID is acting more like a cold would, in which case you might get symptoms, you might spread it, you probably won't spread it to other people unless you have symptoms, and those symptoms are not going to be bad enough to land you in the hospital or make you really sick. So that's what we're seeing. I think the data is suggesting that even with the Delta variant. And so going forward, I don't, it's hard to predict anything with this pandemic and this virus, but what we see right now is that, you really don't need to test if you're fully vaccinated and you don't have any symptoms at all.
Okay, thank you.
Thank you, Michael. Any follow-up questions on that? All right, Stella from KMUD.
Hi, thank you. So Dr. Hoffman, I saw revise the quarantine order to state that regardless of vaccination status, people should still isolate for 10 days after symptoms start. I was just wondering what was the reason for revising this?
Yeah, so we updated the quarantine orders, which state that, and it was really something we had been doing in practice for quite a while, and across the state, CDPH had updated the quarantine orders months ago. So it was really just to reflect the practice that was going on in the county already. But it stated on the quarantine orders more clearly that if you were fully vaccinated and exposed, you don't need to quarantine, and if you're asymptomatic, unless it's required by your work or in a rare case that maybe public health would recommend you to quarantine. So The other piece was to update another thing that had been really in practice for a long time, which was that if you're within 90 days of an infection and you're re-exposed, or that you don't have to quarantine again. The isolation has never been changed. People who are fully vaccinated, CDC, CDPH have always recommended that we continue to isolate those folks. So that isolation order didn't change in any real way. We just changed some of the language that was slightly outdated.
Okay, thank you.
Thank you, Stella. Any follow-up questions on that topic, quarantine or isolation orders? All right, we'll go back to Isabella from the Time Standard.
Hi, I would just ask, are all local hospitalizations and deaths still only in unvaccinated individuals?
We have not seen any deaths in any fully vaccinated individuals, and there has been hospitalizations among fully vaccinated individuals, but very, very few.
Can you elaborate on what the severity of their hospitalization was, or what it was that landed them in the hospital?
You know, what I would, rather than look at our local numbers because they're so small, and it is, you know, when we talk about a small county like ours and we're talking about really small numbers, it's, you know, getting into protected private information. What I will say is that looking at the statewide numbers, the nationwide numbers, you know, you're looking at an extraordinarily small percentage of people who are getting hospitalized, who are fully vaccinated. You know, percentage-wise, if you work out our percentages here in Humboldt County, it's going to look very similar to what it is, you know, for the rest of the state and the country. It's extraordinarily rare. You know, when I talk about it, it's 80 times more likely that you're gonna get COVID if you're unvaccinated. It's even more likely than that you're gonna be hospitalized if you're unvaccinated than if you're unvaccinated than if you're fully vaccinated. So those numbers are very much holding up here. The other thing I can say is that, you know, what we know about folks who become hospitalized who are fully vaccinated tend to be older, tend to be higher risk, have comorbidities, certain medical conditions that put them at higher risk for hospitalization. You know, so that's another reason, again, and that's actually true too with the Delta variant from the UK. The data is showing that, you know, the folks who are getting hospitalized with the Delta variant who are fully vaccinated are older and have more comorbidities. So again, another reason to consider if you're, you know, in that group, or you have family and friends or loved ones that you spend a lot of time with, to consider continuing to wear a mask in a public place to protect yourself and your family.
Thank you, I appreciate it.
I just said, I think it was in the month of May, which is the last federal numbers we have. And Dr. Hoffman, please push back on me. I think on hospitalizations, 0.1% of hospitalizations in the month of May were those who were vaccinated, 0.1%. All the others were unvaccinated, according to the federal government throughout the United States. And I think 1% of deaths in the month of May were folks who were vaccinated. 99% were those who were unvaccinated. But that's federal, and that's the month of May. But Dr. Hoffman, if you want to correct me if you have.
Yeah, no, you're absolutely right, Senator McGuire. And I would even say, while those numbers are shocking and staggering, they're probably an overestimate because a lot of those are not confirmed. You know, even the California numbers, they look at, they can't always say for sure whether that person was hospitalized for COVID, or maybe they just were COVID positive on hospital admission, whether they died because of COVID or something else was the reason. we'll continue to watch our numbers very closly here, but and if it gets to a point where we can sort of give local numbers on that, I'd be happy to do that. But I don't think it's going to really deviate too much. The bottom line is, if you're fully vaccinated, your risk of hospitalization and death is extraordinarily low compared to if you're unvaccinated. And that is remaining true with our local numbers as well.
Thank you. Iridian from the North Coast Journal.
Hi, I had a question about the positive cases in children under 9. And so I was just wondering if they're believed to have been infected like at home, if someone brings the virus into the home because they got sick, or if it's community spread.
Great question. Yeah, the vast majority of those youth who are getting infected with COVID-19 here in Humboldt County, it's going to be from a family member in the home, get-togethers, gatherings. It's not typically in school or their youth programs where they're taking precautions, or in public places where people are taking precautions because unvaccinated people are wearing masks in those places. So they're almost always exclusively in the private setting where people are not taking those precautions.
Thank you, Iridian. Michael from the North Coast News.
We touched on everything I was looking to discuss. Thank you.
Thanks, Michael. Stella from KMUD.
Hi. So Senator McGuire, you mentioned that Humboldt County is below the state vaccination level. Do you have any thoughts on why that's the case?
It's rural counties in California are trending below the statewide average, not just Humboldt County. And in fact, what we're seeing across the state, more women than men are getting vaccinated across California. I think there's a few factors, and I don't want to step on the toes of Dr. Hoffman, as he is the expert. But number one, the isolated nature of communities, it makes it more difficult to be able to get vaccinated, which is why the state needs to continue to fund mobile vaccination clinics, which is why you saw that over 300 million put into this year's budget. Number two, I think that what we're seeing is the vaccination rates, in particular for folks who have service-related jobs and the ability to be able to get out of their job in rural California and go get vaccinated. That's also an issue. And then we are seeing some slight deviation between political beliefs, if I could just be candid on that. And there tend to be, not in all cases, I don't want to overgeneralize, but there tend to be per capita more conservative leaning families that live in rural California. And there's a hesitancy on that fact as well. But those are the three issues. In particular, though, the isolated nature of communities. But Dr. Hoffman, I don't ever want to step on toes, but that's just what we've discussed with CDPH, but I'll turn it over to you as the expert.
Yeah, no, thanks, Senator McGuire. You're right. That is a large majority of what we're seeing here. The rural northern counties and other rural counties in California have struggled to meet the statewide median. Humboldt County, we're actually much better than many of the other counties in Northern California. I mentioned 65% of our eligible population, 12+ population, have at least one shot, whereas the statewide median is around 69%, 70%. So we're just a few percentage points below that. And we keep chipping away at that. Every week we're getting out there with the mobile clinics, getting, a couple thousand more people, not just our own clinic, but also all the other clinics out there who are doing this work across the county, continuing to work to chip away at that. And so we hope that we'll be able to continue to do that. I think another thing in the rural communities that we're seeing is the wait and see folks, the folks who said, you know, I want to see if this is safe, if this is really going to work. And I think that the data and evidence is very clear. It absolutely works and it is absolutely safe. And so hopefully we can get that message out to more people, you know, either through talking to folks if you are fully vaccinated, letting them know your experience, that it is safe. And just with more time, I think people will feel more comfortable. It's already been, you know, since December, we've been giving these vaccines to tens of millions of people across the world have received the vaccine, hundreds of millions. So, I mean, the proof is right there. We don't, the studies have been done, the trials have been done. Many millions of people have received the vaccine. It is safe, it is effective, the numbers we've talked about today. I think the last piece to get to rural communities is that because of the way that the vaccine has been rolled out, and this was by design, it was because of the vaccine and needs that were for the vaccine rollout, was that it was never put into physicians' offices. And I think especially in rural communities where people really look to their physician as the person who is going to recommend a medical treatment for them, they're less likely to just, you know, take the recommendation of public officials, of the government, of a pharmacy. So I think we're at a stage now where we really need to get physicians' offices to reach out to their patients who are unvaccinated, to really strongly recommend it, and get the vaccine into to physicians' offices as much as we can. I know we're working on that at the state level. There's now incentives out there for physicians' offices to start to provide COVID-19 vaccine in their office. And so hopefully with some of those incentives and more time, we'll be able to get to those folks.
Thank you, Dr. Hoffman. We have just a few more minutes here. Do reporters have any additional questions? All right, seeing none. Before we go, I'd like to ask each of our panelists if you'd like to share any closing thoughts or share one of your biggest takeaways from the county government or our community's response to the pandemic as we approach this transition to a departmental operations center. We'll start with Director Pereira.
If it's all right, can I jump in here real quick?
Mai, go ahead.
Sorry, Senator McGuire had to jump off. He had to go vote, so they pulled him really quickly. I just wanted to let you know that he says he's very sorry, and thank you so much for having us.
Thanks for letting us know, Mai. I appreciate that. So Director Pereira, would you like to pick up that question?
Yeah, absolutely. I just want to say when I reflect back on what our COVID response has been and looking ahead to us transitioning into a new normal, still responding to COVID as an emergency, but really integrating COVID response into our day-to-day functions as public health. I really just want to express my gratitude for public health staff who have been incredibly resilient and agile and really have stepped up to the plate to serve this community, work long hours, working 7 days a week, doing whatever it takes to get the job done to support this community. And we couldn't have done it alone. It really has been a whole community effort. We've had partners like OES, we've had the health, our healthcare partners, our nonprofit partners working together. So I just really, even though we still have a lot of work ahead of us, we're not done. COVID is not gone away. But I think it is important for us to pause and really recognize and celebrate the achievements that our community has accomplished coming together, working to keep our community safe. So thank you.
Thank you very much. Ryan?
I echo a lot of what Director Pereira said. This past 15 months has really been a sacrifice for a lot of people. They've sacrificed time with family to dedicate to this response. And for those people who weren't directly involved in the response, the people who this incident have affected, they've sacrificed their livelihoods in many cases. And, I think it's important to recognize that even though we've made some tremendous progress in the community in addressing the threat of COVID, it's still important for people to understand their own potential risk. And as Dr. Hoffman said, we're at a point where people need to make that personal choice to consider their own health and safety. And if they feel that they are vulnerable or they have family members or friends who are vulnerable, they still need to take those proactive measures or protective measures to keep themselves safe. But I'm really thankful for the partnerships with public health, DHHS, really all county departments have been involved in this the last year. Numerous cities, community service districts, our tribes. It's been really humbling to see the community effort with something so frankly traumatic. So I have a tremendous amount of gratitude, and I'm humbled to have been part of the response. And honestly, it's a little sad to walk away when it's not done yet, but I am very optimistic for what public health and DHHS are going to do to see this thing through. So thank you.
Thank you, Ryan. Dr. Hoffman.
Thank you, Ryan. Thank you, Sophia. Very much the same, just extreme gratitude for the staff from both OES and public health, the EOC, the JIC, all the players who have been part of the response within government, and then just all the folks who outside of these walls have given so much, the healthcare workers, the frontline workers, the grocery store workers who risk their health daily to keep everything going. And then those who couldn't work. I think that, we're at a different point now. Things are opening back up. We're all feeling more confident. I think the biggest thing, just looking at how we got to this point, is to look at vaccinations. We had a lot of time where we were just trying to hold on tight until we could get to the vaccinations. And then for the last 6.5 months, we've been vaccinating like crazy. It's really allowed us to move forward with a level of confidence. We're not done yet. We still need more. We need more people to get vaccinated. I'll just close with, the time is now. The wait and see is done. Evidence is clear. And so take your personal responsibility and make that choice and go out and get vaccinated. Many opportunities out there. And if you have any questions, let's always call the JIC for information about where you can get vaccinated. Thank you.
And a reminder, you can reach the JIC at 707-441-5000. And one more plug to go to myturn.ca.gov to view a full list of the clinic schedules, including this Friday night at the Humboldt Crabs game, starting at 5 p.m. Thank you all very much for joining us. Thanks to our panelists for being a part of the news conference today. I will send links to the recording to media as soon as possible.